Thank you very much. Today I'm here in Kakamega and we had multiple meetings and multiple visits. First of all, we began with a meeting with the CEC, the COOs, and other important stakeholders on Matters National Equipment Service Program, where we were able to map out the facilities and see how we can improve the capacity in matters of equipment, that is facility equipments. And this is not only at Kakamega but at national level. And we have identified interventions moving forward in order to capacitate our stakeholders to identify the equipments they need in order to offer quality care services for Kenyans. Additionally, we moved to the next meeting, and the meeting was with regards to KEMSA and how we can support in the recapitalization of health products, especially the drugs, the essential medicines. And this was not only in Kakamega, but again in the various counties, Western Nyanza and among other counties. And so we are happy to report that Kakamega County will be able to receive essential medicines to the tune of 150 million following the payment of the debt, which was around 70 million. Additionally, we went ahead to have another meeting with various stakeholders, including partners such as USAID, to review critical areas that we can improve, especially in the implementation of Taifa Care. And following that, we moved to the Kakamega County Referral Hospital, again where we engaged with the managers, the administrators, among others, to see what went well, what went less well during the rollout of the Social Health Authority as well as Taifa Care. And we are happy to report that following, our interactions, our engagements with the healthcare workers as well as the patients, we take note that the uptake is good. Most of the patients are registered. Actually, we could say in the tune of 96% have been registered, and most are benefiting again from the Social Health Authority. We were able to visit the maternity, the cancer, the oncology ward, the maternity ward, the pediatric ward, where we have found many patients who are benefiting. We take note of the challenges, including the technical challenges, and some of the information that has not been cascaded down to county and facility level. And myself and my team will be able to work together following this assessment and review to ensure that we address all these challenges and implementation is expedited. We have come again to review this facility that has stalled since 2018 up till now, and should have been serving a lot of people around this region and beyond, even the countries, the neighboring countries. And so following the presidential directive, we look to engage and see how we can support in terms of operationalization. And so briefly, that was our visit to Kakamega with the team. Yes, there are measures. We take note of the cases, Mpox cases, and I believe that was one of the areas that has been alluded to by the Director General in his Wednesday media briefing. And so we are looking in matters response to Mpox, and one of the areas we are capacitating, first of all, is surveillance, early detection of cases, and again improving the lab capacity and the prevention, infection prevention and control measures. We are also training various counties that have had cases. We are supplying the personal protective equipment and other consumables to support, as well as medications to manage the cases. And so a lot is ongoing in matters capacity building and following the monkeypox response has been aligned in the World Health Organization. Yes, it is the same case, but first of all, we need to ensure that the capacity within the country is suboptimal before now we think of exporting those cases. And when you review most of these cases, we believe that in Kenya we are well capacitated. And again, now we look at these components. For instance, there is a case that is currently now being handled in Kenyatta National Hospital. And under SHA, the patient will be managed, and I believe that that is one of the success stories that will come up. So our public facilities, and when we look at our national referral hospitals, are well equipped, and we are looking again to further improve the capacities into international standards, so that we can ensure that most of our cases are actually being managed or are able to be managed within the country. But again, for the SHA, yes, there is the component for overseas treatment. Yes.
So what will you tell them?
Now, we need to review the case, because I believe if this patient is taken to one of our national referral hospitals, they'll be able to evaluate and assess, and they'll be able to come up with interventions to support this the child. And that is at the National Referral Hospital. Within Kenya, we are capacitated. But in case that is not possible, then referral can be done to overseas, and management will be done, and treatment again under the Social Health Authority. Yeah, so let us first explore our national hospitals and see whether they are equipped. And probably again to mention is that at times we have patients who go into the private facilities, and you take note again of the grievances. So I'll give an example. For a normal delivery in a public facility is 10,000, right? Cesarean section is 30,000. When you go to some private facilities, the cost will go up to 150,000. When you go to some very expensive high-end cesarean section will go to 300,000, which is actually 10 times the cost of a cesarean section in a public facility, meaning 10 mothers could actually benefit from that. And so you see the cost benefit analysis from a national perspective. That is why we are saying the public facilities, you can see where we are capping it at 30,000 public facilities. Most of them, cesarean sections will actually be able to cater for that. But for a private facility that is asking for 300,000, you see, if we have 10 of them, those are 100 patients that would be costed in a public facility. So those are things that Kenyans need to be aware of, the varying costs. But for the service delivery, again, in public facilities is lower, and yet the outcomes are again similar or better. And so we need to look into that. Yeah. Thank you.
My last question, maybe if I may ask, we've had...
Yes, I think one of the areas that was covered by the Director General yesterday is the implications of the executive order. And as I had said earlier on when I came into office, is that Kenya, we need to be self-reliant. When the political climate changes, various presidents may come with different agendas. And so when we are over-reliant or over-dependent on partners again, at times it may cause some challenges. And really that is why we need a health financing aspect that will ensure sustainability, something that we can depend on, something that we can rely on as a country. And really it is timely that we have started the rolling out and implementation of Taifa Care and Social Health Authority. We are optimistic. We need to look at self-sufficient, self-reliant methods when it comes to health financing, and we should not be overly dependent on our partners, because it could have implications ultimately in future. So it is two things for Kenyans: either to register for SHA and see how we can support in a success of a Taifa Care, or later on in future when donors withdraw, then people are on the streets because there are no medications, there are no health services, because we were always clinging to partners. And so the previous way is better, where we need to be self-reliant. But we are engaging again. We'll be having the meetings with African Union. Next week we'll be having meeting with the East African communities again, and discuss in matters of health financing in Africa, and moving forward, what do we do and how do we engage these critical people, these critical countries that have been supporting us throughout this time, because drastic withdrawal of funds will have implications, outcomes like death, increased morbidity or infections such as HIV and other outbreaks. We have now you could be having outbreaks like Mpox and Marburg, and if there's a instability when it comes to organizations like the World Health Organization, when there's this unstable funding, this will have implications. There's growth of infections, not only at a national but at a continental and a global level, and again these infections will impact on the economy, the social component, among others. So the drastic withdrawal will have implications, and so we are again reaching out to request that these things there's engagement, and there's also internalization of the impact, and seeing how they can support us as African countries, and again as Kenya, to be able to ensure that there's sustainability and we are able to control infectious diseases before they blow out of proportion, before they get out of hand.
So my name is Penina Mkabane. I'm the acting CEC for health services for Kakamega County. Today we've had quite a number of engagements with the National Government Cabinet Secretary for Health, Dr. Deborah Barasa. We've also engaged KEMSA, the Kenya Medical Supplies Authority, on the issue of drugs in this county. We have also had an engagement with one of our partners from USAID, UBJ project, and the discussions have quite been fruitful towards strengthening our health systems here in the county. About the CS visit, most of it was about the National Equipment Service Program, whereby the national government plans to promote, to support counties in terms of equipment from radiology, ultrasounds, CT scan, and even theater equipment. And we are in the progress of identifying the gaps and what exactly the county needs, so that they will know how much they can support us. The other issue we've talked about is SHA registration and the status of implementation of SHA within our county general hospital, and of course which applies to the other health facilities. So as the county government of Kakamega, this county is number 4 countrywide in terms of registration, but we are urging our people to continue registering, because it's only when you register that you can benefit from the services. The other issue is on issue of drugs. We have spent quite a lot of time before KEMSA brought us drugs, and it's because of a pending bill we've had with them. The county government has since paid part of the money. I would say 30% of the debt has been paid. KEMSA has agreed to give us drugs worth 150 million to ensure that our level 2 and level 3 facilities, which include the dispensaries and the health center, are also equipped with the necessary drugs. So With the program we have with KEMSA and with the National Equipment Service, we shall be able then to provide the necessary medical services to the residents of this county at all levels of care in the county. Our partners, UBJ, have also come in. Of course, they are informing us of the measures that have come from the measures that the US government has put in place. There are some benefits we have been having from them, which we may not continue having. For instance, they are now not required to pay, is it transport? Yeah, transport for our staff when they come for meeting, and per diems have now been removed. And therefore, we have to dig deeper in our pockets as a county government to ensure we facilitate all our programs and all our meetings with minimal support from our partners. For now, I may not know, because we have those debts that had been inherited from the previous government, and there are those that we have incurred in the process of offering services. But for now, we have paid them around 70 million. The debt remaining for the mainstream department is about 100 million. Of course, the individual facilities also buy directly from them, and some of them could be having a debt here and there. So we cannot know the exact amount. Yeah. The reason the CS was here is because of also level 6. Apart from the equipment, the president gave a pronouncement that national government will be taking up this facility, which is rightfully so, because if you check the Schedule 4 of the Constitution, national referral facilities are a responsibility of national government. So as much as the county government has put in a lot in terms of land and in terms of construction of the first phase, it is now high time the national government took over, and we have initiated the process of the national government taking it over. From now, we are going to form a transitional committee and agree on a memorandum of understanding, where one of the possibilities is that we'll partner with national government, one of the referral facilities of national government, to operate as a subsidiary as we complete the facility and make it fully operational. Thank you. But next time you're in Western. So ours will be for the local media.